Welcome to the tutorial ACO Preventives and Quality Measures Flu Vaccine. Flu vaccine documentation is an ACO preventive health quality measure. In these tutorials, you will understand the flu vaccine quality measurement calculation, learn how to properly order and record details for flu vaccines you administer in office, and you will learn how to properly record historical information for a flu vaccine patients receive at other locations. This quality measure is met based on the following ratio: a denominator that equals all patients 6 months old and older who have been seen between October 1st and March 31st of the reporting year, where the numerator equals patients that have received an influenza vaccination or reporting having it done since August of the reporting year during that flu season. In this tutorial, you will learn how to order an influenza vaccine and properly record the administration. For patients that receive an influenza vaccine in the office, one of the following must occur. A provider has entered the order in the EMR, and you will work from the task list to administer the flu vaccine and record the details. Or, standing orders are on file in the office that supports an assistant entering the order, administering the vaccine, and recording the details in the EMR. It is important to note the focus of this tutorial will demonstrate the process of entering the influenza order and completing the tasks on the task list. The assumption is that standing orders are in place at the practice to support an MA performing these actions. A standing order allows the assistant to enter the influenza vaccine order directly in the order section of the EMR. On the table of contents list, you will click on Orders and Charges. The Orders Charges window displays with the Orders tab opened. You will click the Add button to begin entering the order. If a diagnosis code is not already in place, you will need to add one. To add a diagnosis code, click the Add button found in the Diagnosis and Problems section of the window. An Add Diagnosis window displays, where you can search for a diagnosis, or if you have favorites, you can open a folder and select the correct diagnosis. Once the diagnosis code is selected, you may click the OK button to return to the order entry window. With the diagnosis code selected, you are ready to order the influenza vaccine. The first thing you need to do, if it is not already set, is to change the type to in-office. Now you are ready to search for the influenza vaccine. In the search field, you can type influenza virus vaccine. A list of options displays. Select influenza virus vaccine inactivated. If this is the first order you have entered for this patient on this visit, you will receive the Ordering Physician window, where you will need to select the provider who gave the order for the vaccine. The order date time fields will default to the current date and time. The communication type box is where you will select how you receive the order. Since you are working off a standing order that is documented and on file with your practice, you will select Written. Note: if standing orders do not exist in your practice, you should not be entering this order, but should wait for the provider to do so and assign the administration tasks to you. With the communication type selected, you can click the OK button. The blue X indicates that some additional details are needed before the order can be signed. The first required element is the dose. In the Details Value section, you will need to type the vaccine dose that will be administered. Next, you will click the Route of Administration detail. From the list of common routes, select IM. With the vaccine details entered, the order is ready to sign. This is done by clicking the Sign button. The order has been placed, and you are ready to administer the vaccine. The influenza vaccine order has been ordered, and the injection has been administered. Now you are ready to enter the medication details and charges. From the patient's chart, you will go to the task list. A task for the influenza vaccine is displayed on the task list. The pill icon represents the medication administration form that must be completed to document vaccine details and to record the charges associated with the injection and medication. The form is accessed by clicking on the icon. The medication administration form displays. The fields displayed in yellow are required and will need to be completed before the form can be signed. In addition to the yellow fields, there are other fields that you should also consider as required. They are NDC number, the Med Charge Influenza field, and the Admin Charge Influenza Vaccine field. The NDC number is the National Drug Code number, a unique product identifier for the medication. The MedCharge Influenza field is a drop-down field where you will select the charge code for the medication. From the list of options, select the appropriate charge. Note: the patient's insurance may determine the code you select. If you are unsure about the proper charge code, please check with either your practice manager or the billing office. With the charge selected, you are now ready to select the admin charge. The admin charge Influenza Vaccine is where you will select the injection charge. Note: several factors determine the code you will select here, such as the patient's insurance and if you are administering more than one vaccine on this visit. With the administration charge selected, you are ready to proceed on with documenting details about the vaccine. Updating the yellow fields is required. Use the manufacturer drop-down to select the vaccine manufacturer. If the manufacturer does not display, you may select Other from the list. Use the scroll button to move down through the form to make sure you have updated all the applicable fields. Once all needed and required information is entered, you are ready to sign the form by clicking the Sign icon. You are returned to the task list, and the form task displays with a green highlight indicating it is completed. Clicking the refresh icon on the task list will remove the task from the list. This concludes the in-office medication administration portion of this tutorial. In this session, you learned how to add a diagnosis code for an immunization, how to enter an order for an influenza vaccine, and lastly, you learned how to complete a medication administration form to record billing and administration information.